How is your bowel doing today? Any issues? Today, we are going to discuss the 7 warning signs of colorectal cancer and why it's essential to understand this type of tumor. Colorectal cancer is the third most common cancer and the second most deadly. About 10% of cancer deaths are caused by this tumor. Therefore, stay tuned as I break this video into two parts. The first part will cover the signs and symptoms of colorectal cancer, the ones you can see or feel, the warning signs. In the second part, which I believe is the most crucial, we will discuss preventive measures, including ways to reduce your risk, habits to adopt, and dietary recommendations. I will also talk about polyps and why colorectal cancer is increasing among people under 50. This will be a very comprehensive video, so watch until the end and let me know if you know anyone who has had colorectal cancer and where you are from. Please comment below. 7 warning signs. 1. Changes in bowel habits. It's essential to know your bowel habits. Some people go to the toilet right after breakfast, others 2 or 3 times a day, and some only 2 or 3 times a week. What is your bowel pattern like? If you notice any changes in your bowel movements, pay attention. These changes alone are not alarming, but if they persist or worsen, you should see a doctor. About 65% of people with bowel cancer experience changes in their bowel habits. These changes can vary based on the tumor's location, size, and stage. Stools may change in consistency and color, and you may start going to the bathroom more or less often. The main change is persistent diarrhea unrelated to a viral infection, followed by constipation, and then diarrhea again. Any significant change in bowel habits should be noted. 2. Blood in the stool. It's crucial to pay attention to your stools and not flush them right away. Different parts of the colon can cause various types of bleeding. The right side of the colon is larger, and stools are more liquid, which can cause stools to turn black and foul-smelling if there's a tumor. The left side, with more formed stools, can lead to bright red bleeding. Bleeding can also result from hemorrhoids, anal fissures, or even eating beets. However, any bleeding should be checked to rule out serious conditions. 3. Abdominal pain. If you have never had abdominal pain before and now experience severe, recurring cramps or pain while defecating, this could be a sign of a tumor affecting the rectum. If this pain does not go away, see a doctor. 4. Fatigue and tiredness. This is not the fatigue from a bad night's sleep, but prolonged tiredness lasting weeks or months. In colorectal cancer, this can result from hidden anemia due to slow bleeding from the tumor. Cancer cells use a lot of energy to divide quickly, depleting your nutrients and causing chronic fatigue. 5. Bloating. Abdominal bloating or swelling can be a common symptom of colorectal cancer. Tumors may partially or completely block the bowel, leading to a buildup of gas and stool. This can cause colic-like abdominal pain and should not be ignored. 6. Unexplained weight loss. If you are on a diet, weight loss is normal. However, unexplained weight loss without changes in diet or exercise can be a sign of colorectal cancer. Tumors can alter the body's ability to absorb nutrients, suppress appetite, and increase energy expenditure. 7. Feeling of incomplete evacuation. This feeling, called tenesmus, occurs when you feel like you haven't completely emptied your bowels even after a full bowel movement. This uncomfortable sensation is a common symptom of bowel cancer, caused by the tumor partially or completely blocking the bowel. Risk factors for colorectal cancer. Several factors increase the risk of colorectal cancer, including age, inflammatory bowel diseases, like Crohn's disease, or ulcerative colitis, genetic syndromes, like Lynch syndrome, or familial adenomatous polyposis, family history, and height. Unhealthy lifestyles, such as smoking, alcohol consumption, a sedentary lifestyle, low intake of fruits and vegetables, and high consumption of processed foods and red meat, also contribute to the risk. Why colorectal cancer is increasing among younger people. The increase in colorectal cancer among younger people is primarily due to unhealthy diets, excessive intake of industrialized foods, lack of exercise, and rising rates of obesity and overweight. To reduce the risk, it's recommended to drink plenty of water, eat a diet rich in fruits and vegetables, reduce the intake of red and processed meats, eat anti-inflammatory foods, exercise regularly, avoid smoking and alcohol, and undergo regular screenings. 7 tips for preventing colorectal cancer. Drink plenty of water to keep your bowels functioning properly and reduce constipation. Eat plenty of fruits and vegetables rich in fiber and antioxidants to speed up stool passage and improve intestinal flora. Consume natural anti-inflammatory foods like turmeric and cinnamon. Drink milk and dairy products. Contrary to popular belief, recent evidence suggests milk is not inflammatory and may protect against colorectal cancer. However, if you're lactose intolerant or allergic, Avoid it. Exercise regularly to improve bowel function, regulate hormones, reduce inflammation, and maintain a healthy weight. Avoid alcohol and smoking. Get regular checkups. At the very least, test your stool for occult blood. If you're over 45 and at intermediate risk, consider a colonoscopy. For high-risk individuals with a family history of colorectal cancer or genetic syndromes, screening should start earlier. A colonoscopy can detect and remove polyps before they become cancerous. This early intervention can significantly reduce the risk of developing colorectal cancer. Early diagnosis and treatment greatly increase the chances of successful treatment and complete recovery. Remember to share this video so more people can be aware of these vital signs and preventive measures. Thank you for watching, and take care of your bowel health to keep your body healthy.